Dear students, we are happy for you that you've already finished the third year of your studying. You are well prepared for now and for studying new branches of medicine. Today we are going to speak about urology. Unfortunately, we are not able to see each other eye by eye because of COVID-19 epidemics. It's a great problem for everyone, but these months of online studying were difficult but generous for new abilities for you and opportunities, of course. Take care, be healthy, and study well. Let's begin. It's Introduction to Urology. Urology is a science that studies the etiology, pathogenesis of diseases, classification, clinical manifestation, and master the basic methods of examination and treatment of patients with urological pathology. Of course, as students and future doctors, you should know something about ethical deontological foundations, the theoretical material from lectures and classes. You should know that independent work is obvious for you and important. Checkpoints of the discipline. As a student, you should know clinical anatomy, physiology, and other branches of medicine that you've studied before for 3 years. To know methods of investigation, to determine the etiological and pathogenetical factors, to establish a preliminary diagnosis, to determine the tactic of treatment, to diagnose and provide urgent medical care, and of course to use the basic principles of the prevention of urological diseases. Here you can see the picture of kidneys, and we are going to speak them about later. As a medical branch of studying, it's connected between different kinds of activity as surgery, orthopedics, traumatology, therapy, cardiology, neurosurgery, oncology, anesthesiology, intensive care. As a doctor, you should be well known in this. And now about kidneys. Brief information. The kidney are two bean-shaped organs in the retroperitoneal space. It consists of parenchyma and stroma. The first one consists of cortex and medulla. Calyces and pelvis are parts of the stroma, about 11 centimeters in length. This organ is situated between the 20th thoracic to lumbar third vertebra, and the right one is slightly lower because of HEPA. Renal arteria, renal vein, and ureter are parts of renal hilum, as you can see in this picture. Remember the anatomy. Kidney function. You should know that these are filtration, reabsorption, secretion, excretion. Damages of these processes cause diseases. In this slide you can see something about blood supply of this organ and functions according to these parts. Check your skills in anatomy and pathomorphology. This one is more accurate scheme and about veins, arteries, and other structures of renal parts. The next one is ureter. In these pictures you can see the situation of these organs and their parts of the walls. A fibrous cord, muscular cord, and mucous layer. The ureters are tubes made of smooth muscle fibers that propel urine from the kidneys to the urinary bladder. It's the main function of this organ. The length is between 25 to 30 centimeters and around from 3 to 4 millimeters in diameter. The ureter is lined by urothelial cells, a type of transitional epithelium, remember something about histology, and has an additional smooth muscle layer in the more distal 1/3 to assist with peristalsis. The next one is urine bladder. You can see the structure, form, and situation, and their wall scheme. Epithelium, of course, transitional epithelium, of course, lumina propria, submucous layer, detrusor muscle, and adventitia. Bladder is a hollow musculoelastic organ that collects and stores urine, the main function, from the kidneys before disposal by urination. Sits on the pelvic floor. as you can see at these pictures, and anatomical structures of these bones. The typical human bladder holds between 300 to 500 milliliters, but can hold considerably more. And you should remember that bladder of man are more sustainable to collect more water or urine. Urethra connects the urinal bladder to the urinary meatus for the removal of urine from the body of both females and males. Here you can see macro scheme of this organ with these structures: outer circular muscle, inner longitudinal muscle, submucous layer, epithelial lining, and lumen, of course. Here it's a structure of organs and their connections. Female urethra is about 5 centimeters long between the clitoris and the vagina, extending from the internal to the external urethral orifice. The meatus is located below the clitoris and is placed behind the symphysis pubis. It's important for knowing in something in gynecology. Its direction is obliquely downward and forward. The differences between male and female urethra. You can see that male is long, about from 18 to 20 centimeters. Function is urination and ejaculation of semen. Additional function, and course is curved double. Here you can see the structure and movement of the urine from bladder to orifice. And female urethra is short, about 4 centimeters. Function is only urination, and course nearly straight. Follic catheterization is easy, and in males it may be difficult. Actually, you can see the structure and other organs situated near this organ, urethra. The next one is male urethra. It has 4 parts. You should know it from the anatomy. Preprostatic urethra, inland, length from 0 top 5 and 1 top 5 centimeters, and dependent of the fullness of the bladder. Prostatic urethra has such structures as an ejaculatory duct that receives sperm from the vas deferens and ejaculate fluid from the seminal vesicle. Several prostatic ducts, fluid from the prostate to the ejaculate, and prostatic utricle, which is merely an indentation. These openings of these parts of prostatic urethra are collectively called verumontanum. Here you can see the detailed scheme of these parts of the male urethra. Remember them. The next one part is membranous urethra, from 1 to 2 centimeters, through the external urethral sphincter in the deep perineal pouch. The bulbourethral glands, also called Cowper's glands, are found posterior to the region but open in the spongy urethra. Spongy urethra is the 4th part of male urethra, openile one, from 15 to 16 centimeters in length, and travels through the corpus spongiosum. Actually, you can see the structure of this organ. Nothing difficult, but you should remember them.